Now before we dive into today's video, do not forget to subscribe to my YouTube channel to stay up to date with our videos and free resources. And please remember that you can access our review courses, quizzes, and flashcards by going to nursingcram.com. In this video, we're going to go over drugs that have teratogenic risks. So what is teratogenic? Teratogenic is anything a pregnant person that is exposed to or ingests during pregnancy that's known to cause fetal abnormalities. We're going to focus on 4 commonly used psychiatric medications and the specific teratogenic risks associated with them. So let's get started. So the first one we're going to look at is benzodiazepine. So benzodiazepines are a class of medications that's often prescribed for anxiety and sleep disorders. However, they come with certain teratogenic risks that we need to be aware of. The 2 significant risks associated with benzodiazepines are floppy baby syndrome and cleft palate. So floppy baby syndrome refers to a condition where the newborns have muscle weakness and poor muscle tone. And cleft palate, on the other hand, is a congenital abnormality and is characterized by an incomplete closure of the root of the mouth. So the next medication is carbamazepine. So carbamazepine, commonly known as Tegretol, is an anticonvulsant medication that's used to treat epilepsy and bipolar disorders. When it's used during pregnancy, carbamazepine has been linked to increased risk of neural tube defects. And neural tube defects are serious birth defects affecting the brain, spine, or spinal cord on a developing fetus. So the next drug is going to be lithium. So lithium is often prescribed for bipolar disorder, and the main teratogenic risk associated with lithium is the development of Epstein anomaly, which is a congenital heart disease, and more specifically, it's a defect of the tricuspid valve. And the last drug is going to be valproic sodium, which is same as Depakote. It is more commonly used to treat epilepsy, bipolar disorder, and migraines. And it does carry a significant teratogenic risk, particularly related to neural tube defects. As stated earlier, neural tube defects are abnormalities that affect the spinal cord or brain development of the fetus. And spina bifida, which is a specific type of neural tube defect, is more frequently seen with the use of valproic sodium. And it can happen anywhere along the spine if the neural tube does not close all the way. Valproic sodium can also cause atrial septal defect, which is a birth defect of the heart, in which there's a hole in the wall, which is the septum, that divides the right and the left atrium. And lastly, valproic sodium can also cause cleft palate, which we said earlier is also seen with benzodiazepines. If you're having a hard time memorizing all these, here's a memory trick that helps me remember each one. So for benzodiazepine, what benzos do, they make you feel calm. So I think of feel calm. The F is for floppy baby, C is for cleft palate. Next one is carbamazepine, which is Tegretol. So I think of Tegretol, the T is for tube, so neural tube defect. And for lithium, I think of a lithium battery, which they store energy. So energy, the E is for Epstein anomaly. The next one is going to be valproic sodium, and I use the word scan. So the S is for spina bifida, the C is for cleft palate, the A is for atrial septum defect, and the N is for neural tube defect. I hope this video has been helpful, and hopefully the memory trick that I shared with you will make it easier for you to remember the teratogenic risks that are associated with these psychiatric medications. Thank you for watching this video, and remember that you can access our resources, review courses, quizzes, and flashcards by going to nursingcram.com. And don't forget to like and subscribe.